If you want to live longer, you need to brush your teeth longer. Find out what it's all about coming up next on Carolina People. Good morning. Welcome to Carolina People. This morning we're at the E. Craig Walls Senior College of Business Administration here on the campus of Coastal Carolina University. We're focused on the American Dental Association's Oral Longevity Campaign, and we're visiting with one of its longtime volunteers, Dr. Baxter Sapp, Jr. Good morning, Dr. Sapp.
I'm glad to be with you.
What a treat to get you in, and of course a big birthday celebration yesterday.
Yep.
Congratulations.
Thank you very much.
Absolutely. This is a 3-week trip down to Myrtle Beach. Obviously, the thrill of you being in town last week for the big conference.
Well, we had a great meeting last week, and exploring the longevities of
the dental practice.
Of the dental practice. Right?
Absolutely. You know, to think about this, the North Carolina Dental Society, year after year, coming down to Myrtle Beach. It's been a great location, the Kingston Plantation.
Fantastic. It's been great. We have really enjoyed every bit. And of course, the families come.
Oh yeah.
Because they enjoy the ambience of the beach, and it makes it a very good place for learning.
And speaking of family, last week in town with you was another doctor, Dr. Baxter Sapp. Share with us a little about the other Dr. Sapp. Of course, when folks come to y'all's office now, they don't know, how do they make a difference between the two of y'all?
Well, it's Dr. Macon and Dr. Baxter. That's the way we distinguish it. And Macon is a graduate of 1990 School of Dentistry at Chapel Hill.
Right.
And he and I have been in practice now all together that entire time and built a new office in that period 3 years ago.
Oh, yeah.
So we are looking forward to his sister, my daughter, coming in as a hygienist in a couple of years.
Is that right?
Yeah.
Miranda,
right.
How exciting.
Wonderful.
A family operation. Are there many father-son or father-daughter operations throughout North Carolina or throughout the country?
Well, I don't know. There are probably a lot, but when it gets to the numbers, I can't say, you run into somebody and they'll tell you, I practice with my son or I practice with my daughter. And as it is now, there are more women in the profession than there were years ago. I can remember when I was in dental school, we had no women in our class.
No.
As a matter of fact, I can't remember a woman that was in the entire school of dentistry at Temple University in Philadelphia. And today, apparently 1/2 of the school is women.
Is that right?
Yeah.
Fascinating. Well, good for them. They need to be moving forward. As you know, of course, my grandmother, who attended law school at the same university that you went undergrad and where Macon went for dental school, obviously was there in 1920 when she was the only woman in the class. You think about that, those impacts obviously for women really making a stand as far back as that to now, obviously at Temple or the University of North Carolina to really be making an impact.
It's different nowadays.
Absolutely. How exciting to get Miranda into practice. Real quick about yourself, Dr. Sapp. Are you originally from North Carolina?
I was born in Durham, reared in Raleigh, and when I went in the service, the further I got away from North Carolina, the more I wanted to come back.
Listen to you.
And so when I got out of the service, I joined the staff at Duke University Medical Center and stayed there for about 17 years.
Wow.
And it was a very, very good experience to be in one of the leading healthcare centers in the country. And I guess this is what has fostered my interest in this program of oral longevity, the relationship between dental health and general health.
And overall
It's
health.
A reality and has been for years.
Right, right. And it's been laid out. It's not just coming from Dr. Baxter Sapp. It's coming in from many years of research year after year. What actually got you interested in dentistry at an early age? Is it something from a very early age, or was it just in the college area?
Well, my first cousin was more like my brother, was a physician, but I hated the hours he had to keep. And my grandfather was a dentist, and I thought, well, that's something that I would enjoy because I enjoy working with my hands. And I thought this would be something that would be something I could enjoy. And
Right.
as it is right now, I'm in practice for now 57 years.
Oh, come on.
Yep.
57?
57
My
years
Lord,
of
wow.
continuous practice.
That is tremendous. That's probably one of a kind in the Carolinas, if not in the Southeast, or in the country. I mean, there's obviously dentists, I'm sure there's some that have practiced longer, but probably not much.
Not many.
That's amazing. Congratulations.
Thank
That's
you.
tremendous.
Uh-huh.
And of course, we sure hope to get you back next week as well to highlight more about the Oral Longevity Project, because there's so much to it. What actually caused the kicking off of the project?
Well, I got into this in an unusual way.
Yeah.
Because I had, when this DVD that was produced by the ADA Foundation, the GlaxoSmithKline, was mailed to all the dentists in the country, I was so impressed with this 45-minute instruction of the relationship between dental disease and general health. I called the ADA and I thanked them for it. And I didn't realize this, but they published my comments in the ADA News, which I did not see in the ADA News until somebody called me one day and asked me to come and talk with them about the project. And I said, "What project?"
Oh, come on.
And so as a result, I went and talked to them about the project after I'd done some study on it. And I realized that this was started by a very prominent man in the field of education, Dr. Arthur Dugoni. Dr. Dugoni was a long-term dean of the University of the Pacific, one of the outstanding dental schools in the nation. He also served as the president of the American Dental Association, and he is currently now serving as the director of the ADA Foundation. And I could see his signature on this program, and I think he probably is the one who was it was his brainchild, and but there were many others who worked to make this a reality. And of course, a lot of this comes in this supplement.
Let me hold that up so viewers can see the special supplement that came out in September of '07.
Right.
And of course, the Consumer Healthcare Division of GlaxoSmithKline and the ADA and the ADA Foundation working hard. And GlaxoSmithKline's been working for years on making sure that folks help recognize that significant connection between oral health and or dental health and overall health.
Well, the interesting thing about this is that GlaxoSmithKline is a derm firm.
Right. Yes, has a very strong presence
the
in
past
the
chairman, Charles Sanders, is a neighbor down the street.
Is that right?
It's awfully nice to have this so close to home.
Absolutely.
And he's very interested in all of this.
Oh, yeah. Oh,
and he is a physician by training.
That sure helps, very definitely. Well, when you see that, and when we talk a little bit about the history there, it is something, as we said, not just coming out of your mouth, but something that's been researched for years in the past. I know you brought a book from Dr. Barkley, which highlights a lot about the causal connection between dental health and overall health. But what is the, when you think about it and just talk about it in normal terms, how does that come about? Why is there a significant connection between my dental health and my overall health?
Well, I think perhaps what we see is that we have an increase in the aging population. For instance, today's world, 1 out of 8 individuals over 65 years of age.
Oh, yeah.
And 20 years from now, 1 out of 5 is going to be 65.
I saw that.
And so we got all these people who are 65 years of age, like 35 million.
Right.
We're back in 2007.
Right.
And in 2030, we expect there to be 71 million
believe
people. And of course, the 85-year-olds are back in 2002 was 4.1 million, and we expect that to be 7 million.
I was amazed to see even the figures that you had in a little preparation you provided. Thank you again, from the Hallmark Company, just one company.
Oh, yeah.
That to share with viewers how many cards were sold.
There were 83,000
right.
100-year-old birthday cards sold last year.
Unbelievable.
And that's just one company.
Right, right.
And of course, you know that a lot of people who bought a card for a 100-year-old person, but the thing about it, they're 100-year-old people. More of them are available now in our society. And as the years go by, with the good health care that is developed in this country, and that there are going to be a lot more people that
I was
age.
amazed, and of course for you, having practiced for 57 years, the first, I guess, 17 of that 57 after the service there in the Air Force, 17 of those years at Duke, and then since 71, I think you said continuous in family practice there.
That's
But
right.
for you, you've probably seen even lots of families that go on. What about for yourself, some history there of, without talking particulars about patients, have you seen some patients really progress and maintain good oral
I
health?
always think back to an experience when I was a sophomore at Carolina
Oh, yeah.
in undergraduate school. And I was on the highway one Friday hitchhiking back to Raleigh, and I got a ride to Durham, and this nice lady picked me up outside of Durham, and I got in the car, and we began to chat, and I asked her where she was from. She said Raleigh, and she was going there. Be glad to take me close to where I lived. And that was wonderful. And I said, what were you doing in Durham? She says, I was visiting a periodontist, one of the few periodontists that were in Durham at that time.
Right, right.
And so on the way time, we began to talk to each other and began to realize that her husband and my father were very good friends, and I had known them for years.
Just from hitchhiking. I mean,
Just from hitchhiking.
Purely random, yeah.
And it was the nicest experience. And when we got to 5 Points in Raleigh, and I opened the door to get out, and she turned and she said, if you ever become a dentist, I'm going to become one of your patients. And guess what? I saw 4 generations of that family.
No. 4 generations of the same family.
Same family. Isn't that incredible?
And of course, that was well before you attended dental school at Temple, when you were a sophomore.
Well, see, I was a sophomore in college,
Yeah.
And they waited until I got out of dental school, and they were some of my first patients.
That is fascinating. That is fascinating. You know, another a very interesting story. I hope you don't mind sharing it with viewers. Last week, when I saw you and your son when you were in town for the North Carolina Dental Society's meeting up there at Kingston Plantation, I'd asked your son, well, now, you, of course, I know your father's a dentist, and you shared with me that your great-grandfather was a dentist. How about your grandfather, Macon, your father, Baxter? And he had said, no, my grandfather was an inventor.
Yeah. Well, he was right. My father was a welding contractor, but he was a very, very creative man. He liked anything he wanted, he built. And he did a lot of interesting things I observed during my lifetime. And he had this obsession that the roads in North Carolina should have a line down the middle so that everybody would know which side he was supposed to be on. Right. But the interesting thing about the roads at that time was that the edges of the roads were not true. And in one place it was wider than another, so it was very difficult to determine what was the middle of the road. And my dad, when he got out on the highway to paint these lines down the middle of the road, it was difficult to find the middle because they had to lay a chalk line, which was labor intensive.
Oh, yeah.
And so he designed this system of mirrors, which was like a rangefinder. And as the truck went down the road pulling the painting equipment, he was going fast enough so that the edge of the road, instead of zigzagging, it almost was a straight line. And he could stay in the middle of the road, and as a result, paint maybe instead of 5 miles a day, he could paint 50 miles a day. And so he did a lot of things like that. And
that's incredible. So before his time, there were no lines down the middle of the roads?
That's right. And can you imagine today getting on a road or any highway or driving into any city and not seeing those lines?
I can't.
It'd
I
be-
can't. I mean, I
it'd
can't.
be frightening,
I can't
wouldn't it?
fathom that. Absolutely. I guess you can't either. Yeah.
But he did a lot of things. He also had a company of school bus stops, and out in the country where kids had having to stand out in the rain sometimes, in
Right.
the weather, and he got companies to pay for the advertising on these little school bus stops, and it's wherever the bus was going to stop, and there was a little house, and the kids were in it, and they were off of the road, and they were out of trouble, and people, just said stay in the house, and
Oh,
they
yeah.
did. And he sold a bunch of those here in North Carolina, South Carolina, Virginia, and Georgia.
That is incredible. With advertising sponsored.
With the advertising sponsored by, I remember one of the big companies that advertised was Carolina Power and Light Company
Is that right?
in Raleigh. Yeah.
That is fascinating, Dr. Sapp. Well, for you think about that. Was it his father or your mother's father that had been a dentist?
It was my father.
Yeah. I mean, there was an inventor, yes, but who had been the dentist? Was that your father's father or your mother's father?
It was my
Your father's father. Okay,
right.
sure, sure. And in that, was there anything about the practice that, for him growing up, he must have determined that, I don't want to be a dentist, I want to do something. I mean, did he make a conscious decision to become an inventor?
Well, I don't think so. He really didn't. His brother attended the Baltimore School of Dental Surgery,
Right.
and but his junior year he got married and dropped out, and so this was, I guess, maybe one of the things that my parents were concerned about is I was going through school. They wanted me to stay there.
Now, did you ever talk to Baxter III, your firstborn son, or Macon, or even Miranda about getting into what was it about the practice there? Did they come around the office a lot while they were growing up to see you there?
Well, Macon would work in the practice. He was interested in dentistry, and Macon has a great pair of hands, and he always has. He could fix anything. He could build anything. He almost reminded me of my father in many respects, and he was very efficient at things like this. What was so interesting is I got him a job in a filling station when he was 14 years old, and the guy taught him to be a good mechanic.
Really?
And he got interested in automobiles, and when he was about 14 years old, he wanted an automobile. I said, you can't have it. He said, well, I want to take it apart and put it back together, and he did.
Oh, come on.
Yeah, and today, that's the way he is. He loves automobiles.
Oh, yeah.
But he also loves his profession, and he gives it, the majority of his time nowadays.
Absolutely. If he's not with his two girls,
That's
obviously
right.
he's there
Absolutely.
in the office with a lot of other women, and you've got a tremendous practice up there. And to think about, so it's Sapp and Sapp.
Sapp and Sapp.
DurhamDentist.com. I saw that the other day. Speaking of .coms, we got a .org here, orallongevity.ada.org. I guess that's the best if a viewer, and I know that's been up here on the screen a little bit, but orallongevity.ada.org. If a viewer wanted to learn more about the project, of course, they can also come back and be with us next Tuesday. I think you said you'll be back in town, and we will actually be filming out here again next Tuesday, which we're excited about. But you'll be
Very
back
good.
in town, and sure hope you can come
I
back.
look forward to it. I'll be here
with us. Absolutely. For you, of course, somebody who's been practicing as long as you have, you've seen the issues there. Have there been anecdotally or direct evidence where you think about some of your patients that you've really seen their health either deteriorate because they haven't taken good care of their teeth, or that their health has really stayed in good shape because they've been very consciously taking care of their teeth?
I've always felt like, and I've seen evidence over 57 years, that people who keep their teeth are healthier. But there is people have to be very determined about their oral health care on a day-to-day basis. Sometimes the most efficient individual will, for some reason, change toothbrushes,
Right.
and he'll miss a place in his mouth, and I will go in there and touch that area, and it'll bleed.
Oh, boy.
And I tell them, I said, listen, you are missing this. You need to give it more attention, and just have a system and going around the mouth to clean your mouth in a most effective way for at least 2 or 3 minutes. And I think you can get rid of that. And next time I see them, that inflammation, that bleeding is gone.
because they just took it. And you were highlighting somebody who's very efficient and maybe all
That's
over
right.
their mouth, but
Yeah.
leave out one little spot.
Well, you know, some people don't go to the dentist. You know, about maybe 60% of the people go to a dentist, actually, in the United States.
Is that right?
That's right.
Only 60% of the
go to a
population
dentist,
actually
right.
sees a dentist. You mean at all or on a regular basis?
Well, I think the figure's there at all.
At all.
But then when you look at it on a regular basis, I haven't got any figures
Right,
on that.
sure.
But it's awfully good. You know, if you stop and think about this, people go in for a physical examination, which
Right.
is important.
Right.
Some people don't go into a physical examination, and they wind up having some disastrous, terrible health problem
Right.
that sometimes takes their life.
That they just didn't know about.
But I'm always so pleased in having my patients come in, you know, on a routine basis,
Right.
and as a result, they keep their teeth for the rest of their life. And I think all dentists can attest to that those patients who give them an opportunity to look after their mouth
Right.
on a, you know, monthly, not day to day, but you know,
Right.
appointment level
Sure.
program, they keep their teeth. And one of the great pleasures that you have whenever you reach senior age,
Right.
and you may be 75 or 80 years of age, you have some conditions that slow you down and compromise your life. But one of the great things is to be able to sit down and have a good meal.
Yeah.
That is one of the great blessings of old age.
To use your teeth, natural or other, just to be able to sit down. And you're highlighting to use your natural teeth there.
Well, it's interesting. I had a patient in recently who shared a story with me. She said, you know, I've got my own teeth, my natural teeth, and I go to the dining room to have my meal, and I have my friends who I know are wearing artificial teeth.
Right.
And some who maybe don't have their teeth, and
Right.
I watch them, and they push the food around their plates,
Right.
and I don't know what to do with it, but they don't eat it. And but I'm so pleased that I can, you know, chew my food, swallow my food, and be very content that it's well digested when I eat it.
Well, that's why it's so important right now, even though our focus is the Oral Longevity Project in this 3-year campaign and focusing on nursing homes and focusing on retirement communities, folks oftentimes older than 65 and even older than 85 that you were just highlighting there. But really, this starts at an early age. It needs to. For her to have those teeth at 80 or 85, she had to have gotten consciously focused on this at a much earlier age than even you contemplated going into dentistry. I mean,
That's
she had to
right.
get focused on this when she was a child. So where we're potentially talking to seniors today and next Tuesday, a lot of the focus needs to be on folks at a much earlier age.
Well, you know, the oral longevity program is not focused on the younger people, but where you have to stop and think is that people who are 30, 40, 50, 60, 70 years, they're going to be 85, 90, and maybe 100 years of age. And they're going to be in that age where they are compromised health-wise, because that's what aging is all about. And you have to learn to live with that. And if you get there with your teeth, it makes life a lot easier.
Think back to your first couple of years of practice, or maybe even there at Duke, the early stages, some of the biggest differences, some of the biggest advances in dentistry. What's the most prominent that sticks out in your mind, Dr. Sapp?
Well, one of the things that was so dynamic to me was when I went in to join the staff at Duke University. I had the pleasure of working with the original people who started that wonderful institution at Duke University Medical Center.
Right.
And I had lunch with them every day, and we talked. And it was interesting to see what was happening in the medical profession as it was developing and growing. And as you well know, I mean, that medical center has exploded and is becoming a world-class medical center.
World renowned.
World renowned. And it's huge now compared to what it was.
Oh, yeah.
I remember years ago we had a little small parking lot in front of the hospital that everybody parked in, and now we have trouble finding a place to park out
And even
there.
their very large parking
right.
lots.
Yeah.
Yeah. Duke Health.
And Duke Health is reaching out to other areas,
Right.
and they are, they're all over North Carolina now, and I imagine they're in some hospitals in Florida, and I'm sure other states also.
Mm-hmm.
It's expanded, but all of this is part of their oral longevity program.
Absolutely.
Because we are looking now at the fact that it's not dentistry and medicine, but they have come together
Right.
much closer because they are very much related.
Speaking of come together, we're going to have to come together again next Tuesday. If you're willing to be with us, we've run out of time today, I'm sorry to say, but would you be willing to come back and be with us next Tuesday here if Coastal Carolina University be nice enough to let us back in this great conference room?
I'm complimented by your invitation, and I promise you I'll be there.
Fantastic.
Okay.
Thank you, Dr. Sapp. Stay tuned to a little more of Dr. Baxter Sapp, Jr. coming up next. One of the shared goals of all humanity is to grow old with dignity. Think about that, to grow old with dignity. If you've been sitting here the last 30 minutes, we're not thinking about growing old. We're thinking about how can we make a difference to the community, and it's personified in Dr. Baxter Sapp. Recognize it. Go online to orallongevity.ada.org or call your dentist and ask about this caring collaboration, the Oral Longevity Project, sponsored by the American Dental Association, the American Dental Association's Foundation, and GlaxoSmithKline. Folks like Dr. Sapp making a difference every day. Stay tuned. A little more of you next Tuesday. Absolutely. Thanks so much for being with us.
Thank you.